Hello friends, let us now learn some important points about the next topic, which is history of medicine. That is history of the whole medicine and in SPM point of view. So this chapter includes lots of scientists, so you'll have to learn. So first, primitive medicine. Primitive medicine, first we have homeopathy system of medicine. Homeopathy system of medicine includes three principles. One, we have similia similibus curantur. Three principles: similia similibus and similia similibus curantur, which is human drug pathogenesis study. In this human drug pathogenesis study, small amount of drug in healthy person produces symptoms of disease. So even with the help of the drug, we can produce the symptoms similar to those of disease being treated. So small amount of drug in healthy person can even produce the symptoms similar to those of the disease. So that is similia similibus curantur, which is drug pathogenesis study. Then we have single medicine at the time of treatment. At the time of treatment, we will have to give single best medicine to the patient. And said the third principle includes minimum dose to be used. So the founding father of homeopathy is Samuel Hahnemann from Germany. Then this is the first system. Second system of medicine is Ayurveda system of medicine. Ayurveda system of medicine includes, first, Ayurveda is science of life. In Ayurveda, we have three dosha theory of disease. Three dosha theory of disease tells us that disease occurs when there is disequilibrium or problem in three doshas. That means in three humors. In three different things, if there is disequilibrium or if there is problem in three different things, then we call it as three dosha theory, which includes vata is wind, pitta, gal, and kapha, which is mucus. Then the third system of medicine, if you see, that is Siddha system of medicine. Siddha system of medicine tells us that Siddha is achievement. So this Siddha system of medicine is followed by Tamil speaking parts in India and also in abroad. This Siddha system of medicine is based on patient's environment, sex, age, race, and physiological condition. Then we have fourth system of medicine, which is Unani system of medicine. Unani system of medicine is originated from Greece. This includes humoral theory. That means blood, yellow bile and black bile. So the patient's character is divided based on these three as sanguine, phlegmatic, choleric and melancholic. Then we have the important scientists' names. First, profounders of theories of public health. Profounders of theories of public health. First, germ theory of disease by Louis Pasteur. Multifactorial causation of disease by Patton-Coffer. Then we have spontaneous generation of disease theory, generation theory by Aristotle. Then we have discoveries. In discoveries, we have first vaccine is discovered is smallpox, which is by Edward Jenner. The term vaccination is given by Edward Jenner. Term vaccine is given by Louis Pasteur. Vaccines like anthrax, rabies are discovered by Louis Pasteur. First polio vaccine by Jonas Salk. First antibiotic penicillin is discovered by Alexander Fleming. Growth charts which are used in pediatrics for children growth is discovered by David Morley. Homeopathy was discovered by Samuel Hahnemann, and he is regarded as father of homeopathy. Blood group types are discovered by Karl Landsteiner. Citrus fruits in prevention of scurvy is discovered by James Lind. Then transmission of yellow fever is discovered by Walter Reed. Life cycle of Plasmodium is discovered by Ronald Ross. Then if you see the author books, then we come the books and their authors. Now first book, Canon of Medicine, is written by Avicenna. Book of Healing by Avicenna. Antiseptic principles in practice of surgery is given by Joseph Lister. Air, Water and Places by Hippocrates. Ayurvedic text Nidana is given by Madhava. Charaka Samhita has given about Charaka, is given by Charaka, whereas Susruta Samhita wrote the book Susruta. Susruta Samhita wrote the book Susruta. Now, some important points about Hippocrates. Hippocrates is regarded as father of medicine, and he is the first epidemiologist. First true epidemiologist is Hippocrates. Hippocrates wrote the book Air, Water and Places. He is the first physician to reject superstitions. Is Hippocrates is the first physician to reject superstitions. He is the first to describe clubbing. Is Hippocrates. Next we have Susruta. Susruta is regarded as father of plastic surgery and cosmetic surgery. Susruta is the father of Indian surgery. John Snow. Next let us learn about John Snow. John Snow is regarded as father of epidemiology or modern epidemiology. John Snow is the greatest doctor. John Snow studied cholera and established its role of drinking water in its spread. Now we have different fathers of different branches of medicine. So first let us learn from Robert Koch. Robert Koch identified the Vibrio cholera. Organism Vibrio cholera identified by Robert Koch. Now, father of public health. It is not a person. Father of public health is a disease, that is cholera. Then father of modern medicine is called Hippocrates. Father of Indian medicine is Charaka Samhita. Hindu god of medicine is Dhanvantari. Dhanvantari is Hindu god of medicine. Father of modern surgery is Ambroise Paré. Father of epidemiology or modern epidemiology is John Snow. Father of bacteriology is Louis Pasteur. Father of biology is Aristotle. Father of genetics, Gregor John Mendel. Father of modern anatomy, Andreas Vesalius. Father of physiology, Claude Bernard. Father of psychoanalysis by Sigmund Freud. Father of homeopathy is Samuel Hahnemann. So these are the father of medicines. Now we have Ayush or indigenous system of medicine and homeopathy. Ayush is indigenous system of medicine, homeopathy. This Ayush includes Ayurveda, yoga and naturopathy, Unani, Siddha and homeopathy. This is a key component of National Rural Health Mission, that is 2005 to 2012. Then we have the next thing which is important is types of medicine. In types of medicine, we have three different types of medicine. One, state medicine, then socialized medicine, then we have social medicine. In state medicine will provide free medical services to people at government expense. It provides free medical services to people at government expense is state medicine. Socialized medicine provides provision of medical services and professional education by state is socialized medicine. This socialized medicine program is operated and regulated by professional groups. In socialized medicine, this program is operated and regulated by professional groups. If we see the advantages, this will prevent the competition between the practitioners and the clients. This provides provision of medical services supported by the state government. This also ensures the social equity, that is socialized medicine. Then we have social medicine. Social medicine is the study of social, environmental, economical, cultural, psychological and genetic factors. Together we call it as social medicine. Now we have one important one-liners. First country to socialize medicine completely is Russia. First country to introduce compulsory sickness insurance is Germany. Is the first country to introduce compulsory sickness insurance. First country to start family planning program is India. First countries to start blindness control program is also India. First country to establish fingerprinting bureau is also India. In India, first fingerprinting bureau is established in Calcutta 1897. Then in the next page we have the important diseases and new names for the diseases. So first, father of public health is named as disease cholera. The disease cholera is named as father of public health. Barometer of social welfare is tuberculosis. Slim's disease includes HIV and AIDS. Black sickness is Kala Azar. Black death is plague. Cerebrospinal fever includes meningococcal meningitis. Cerebrospinal fluid includes meningococcal meningitis. Breakbone fever is dengue. Monkey fever or monkey disease is Casanur forest disease is monkey disease or monkey fever. Fifth day disease is trench fever. Eighth day disease is tetanus neonatorum is eighth day disease. Then we have 100-day cough. 100-day cough is Bordetella pertussis. Koch phenomenon is nothing but TB by Robert Koch because he gave the postulate based on tuberculosis. Hansen's disease is leprosy. Rubiola is measles. Rubella is German measles. Rubella is mumps. Rubiola, measles. Rubella, German measles. Rubella is mumps. You should remember these differences. Then we have institutes and their headquarters. Central Drug Research Institute is located at in Lucknow. Central Leprosy Training and Research Institute located at Chengalpattu. Central Research Institute is located at Kasauli. Hafkine's Institute is located at Mumbai. LRS Institute of TB and Allied Sciences, Allied Disease is located at New Delhi. National TB Institute is located at Bangalore. National Environment Engineering Research Institute is located at Nagpur. National AIDS Control Organization NACO, it is located at New Delhi. National Institute of Communicable Diseases is located at New Delhi. National Institute of Virology is located at Pune. National Institute of Nutrition is located at Hyderabad. National Jamla Institute of Leprosy is located at Agra. TB Research Institute is located at Chennai. National Institute of Occupational Health is located at Ahmedabad. National Institute of Mental Health and Neurosciences is located at Bangalore. So these are the different about history of medicine. Thank you for watching my lecture. Thank you.